Good morning, everyone, and thank you for joining us today. I am Mark Hauk with the Stoneleigh Foundation, and I will be the Zoom technician for today's webinar. Before we get started, I wanted to let you all know that there will be time for today's speakers to answer questions from the audience. If you have a question, you can click on the Q&A button at the bottom of your Zoom window or in one of the corners if you are on an iPad or cell phone at any time during today's presentation and type your question into the box that appears. We will hold your questions until the Q&A portion of the event. Please include your name and organization with your question so that we can identify you for the speakers. Now, I'd like to introduce the moderator for today's webinar, Stoneleigh's Visiting Fellow, Patrick McCarthy. Patrick?
Thank you, Mark. Good morning, everyone. I am Patrick McCarthy. I'm a visiting Stoneleigh Fellow, currently working with the Columbia University Justice Lab as a research scholar. I'm also a member of Youth Correctional Leaders for Justice. In an earlier life, I was the president and CEO of the Amy Casey Foundation. And in an even earlier life, I was the director of a state youth correction system. We have a truly impressive panel gathered with us this morning to discuss the lessons and implications coming out of efforts to respond to the COVID-19 pandemic, as well as to the movement for racial justice. I'll introduce our panelists and say a bit more about the topic in a moment. But first, I want to turn it over to Ronnie Bloom, Executive Director of the Stoneleigh Foundation, for some welcoming remarks. Ronnie?
Thank you, Patrick. Good morning, everyone, and thank you so much for joining us. I'm Ronnie Bloom, the Executive Director of the Stoneleigh Foundation, and I'd really like to thank the team at the Columbia University Justice Lab for co-hosting this event today. We are thrilled to have nearly 400 people actually register for this event. And I think it's a true testament to the tremendous expertise of our speakers and to the deep resonance and relevance of today's topic. For those of you who don't know, Stoneleigh is a Philadelphia-based philanthropy focused on improving the life outcomes of young people by advancing change in youth serving systems, including youth justice, child welfare, education, and health. We award fellowships to exceptional individuals who work within and alongside these systems to catalyze change. We are incredibly proud that today's moderator, Patrick McCarthy, is a Stoneleigh Visiting Fellow. Thank you, Patrick, so much for leading us in what I know will be a really powerful discussion. Here at the Foundation, we've been grappling with issues at the heart of today's event for quite some time. The twin pandemics of COVID-19 and racial injustice have converged. And while they're highlighting and exacerbating challenges that have always been present in the criminal justice system, they're also providing us with an opportunity to really think about how can we transform our philosophy and how can we transform our entire approach to the juvenile justice system. With that, I'd like to thank you again for joining us, and I will turn it back to Patrick to kick off today's event.
Thank you so much, Ronnie. The network of Stoneleigh Fellows is making a huge contribution to efforts to improve outcomes for young people and their families and to build more effective, more just criminal and human services systems. So thank you for your leadership and for all the Stoneleigh Foundation does to make Philadelphia, the Commonwealth of Pennsylvania, and the nation as a whole a better place. Today's panel will address two overlapping developments that no one would have predicted just 6 months ago. First, the impact of the COVID-19 pandemic. Following more than 20 years of gradually decreasing youth crime and gradually reduced detention and incarceration, recent surveys from juvenile detention centers across the country show steep declines in admissions as states and counties respond to the risk of infection in these facilities. In fact, among those detention centers responding to the survey, there have been greater percentage reductions in admissions from March through May than in the previous 13 years, with many jurisdictions reporting reductions of more than 50% in that 3-month period. The second major development, of course, is the renewed demands to confront generations of racial injustices that pervade every element of American society and that are especially apparent in our law enforcement, criminal justice, and youth justice systems. We appear to be on the cusp of a fundamental rethinking and reimagining of our assumptions, our beliefs, our strategies, our approaches, and our practices, including our historical reliance on youth prisons, that is, the institutional incarceration of children and youth. So what can we learn from these developments? How do we seize this moment to shape a better future? What lies ahead? Where do we go from here? Our panel includes nationally prominent leaders from the judiciary, from probation services, from youth correctional systems, and from community-based alternatives. I'll be introducing each of our panelists in turn and asking them to open with just a few minutes of opening reflection. And once we've heard opening comments from all four panelists, I'll raise questions for them to consider and discuss. As Mark said, please share additional questions you'd like to raise throughout the conversation by typing your question into the dialog box, either on the bottom right hand of your Zoom screen or the upper right hand if you have an iPad. And we'll do our best to get as many of your questions as possible. So we'll begin with Judge Edwina Mendelson. Judge Mendelson is the Deputy Chief Administrative Judge for Judicial Initiatives for New York State, and she was formerly the presiding judge of the New York County Youth Court Supreme Court and administrative judge of the New York City Family Court. Judge Mendelson played a critical leadership role throughout the development and implementation of New York City's Close to Home initiative, which brought New York's young people from distant institutional incarceration back to their own communities, to community-based, evidence-informed programs. Judge Mendelson.
So good morning, hello everyone, and thank you for including me in this important discussion. I am a daughter, a mother, a grandmother, an aunt, a godmother, a guardian, and I really hope I'm a good friend. I try to be. I've spent most of my adult life lawyering in New York City's family court and then presiding as a judge in that same court and leading that court for a number of years before serving in the adult justice system, where I presided in the youth part, where young people, children as young as 13 years old still today can have their alleged crimes addressed in the adult justice system. As a judicial policy leader for the state of New York now, I'm pleased to have juvenile justice, adolescent justice, emerging adult justice, as well as family justice and child welfare issues as part of my portfolio. When I am presenting at forums like this, I use my time to describe who I am and the lens through which I view the work and the discussion that we're having today. And my I ams include the fact that I am a mother from the Bronx who raised many children, and now I must say I'm also a grandmother, I'm aging, who I've raised many children who look like, could be, and are the very same children we're describing and discussing today. And it's important for me to say that. This work is not just critically important, which is to everyone who is listening to the sound of my voice right now and presenting on this panel, but it's also deeply personal to me. We've described the season. I don't like the word unprecedented, but I can't think of a better one. With the impact of this devastating virus, which impacts the communities that we serve differently and in a more harsh way that it impacts others. And I think that's part of the context that we need to consider, as well as the racial justice issues that you've described that have us questioning, and many in our communities questioning our systems of justice. But before this crisis season that we've engaged in, when I think of the work of juvenile and adolescent justice and reform and what we've been trying to do, and you mentioned close to home, I'm thinking of many, many years of long struggle and difficult work, learning and listening from each other, and sometimes uncomfortable conversations. And we're back in a season where we need some more uncomfortable conversations. But there was a great deal of hope and promise. In addition to close to home, which, fewer than 10 years ago, we were sending thousands of children and incarcerating them hundreds of miles from their homes in places far away from their communities and families. Close to home didn't come out of the sky. It came as a result of a crisis, the horrific death of a 15-year-old child from the Bronx who a judge from the court of my heart, the New York City Family Courts, sent as a sentence disposition to an upstate facility where this child died. That, along with community advocacy and investigation by the Department of Justice, Civil Rights Division, led to the ability for New York to have the success that we've had with close to home in legislation and in revolutionary practices in our justice system. And that's been followed by Raise the Age. Just fewer than 3 years ago, we treated all 16 and 17-year-olds automatically as adults when they were arrested. And now 100% of the young people who are arrested for misdemeanors are addressed in our juvenile justice family court system. And more than 80% of those same 16 and 17-year-olds who are arrested for felonies, even violent felonies, are addressed in our juvenile justice system where diversion and rehabilitation is the focus. So there has been many years of hard work, interdisciplinary government agencies, community-based advocacy that resulted in our reforms. Then we have this COVID season and this season that we're talking about now, where overnight we had to change our court operations statewide and nationally. And we went from having a busy, in-person, everyday, crowded court system to doing what we're doing today and actually holding court proceedings from arrest through arraignment through other matters visually in rooms and spaces like this. And we were able to reform our system overnight, but in doing that, to use technology for safety, but in doing that, out of this crisis, we changed our system and reduced our justice system touch on young people even further. And that is something that I'm looking forward to talking with you about, the idea that out of crisis came opportunity. So if we, after all these years of justice system reform, of trying to reduce the system deliberately in New York, we're able to reduce it even further and employ strategies, deliberate strategies through crisis. What can we maintain and not go back to a new normal that resumes use of other methods of incarceration and confinement for young people? I'll stop there.
Thank you so much, Judge. We'll be coming back with lots of questions for you as well. We're going to hear next from Avik Das, who is the Director and Chief Probation Officer for Cook County, that's Chicago's Department of Juvenile Probation and Court Services. Avik?
Thank you. Thank you, Your Honor, for your remarks. I really appreciated it. Thank you, Patrick. Thank you to the organizers for this conversation, to all the participants in the audience. It's really a privilege to be on this panel with you all. I prepared some opening remarks so I could stay on top of it, but know that this will be more of a discussion later on, so if you will. I am proud to be a part of an organization of nearly 400 dedicated professionals of very diverse backgrounds, all of whom are committed to helping children and young adults avoid prison or worse. We hope they leave our justice system better than when they entered it. I have served in Cook County, Illinois as a juvenile probation officer for over 20 years now. Our juvenile court system was the first of its kind in the nation, established in Chicago in 1899. And that same year, our probation department was the first probation department, adult or juvenile, established in Illinois. On any given day in our jurisdiction, about 3,000 or so young people, up until the age of 21, may be involved in some way with our department. About 9 out of 10 are male, 5 out of 10 are age 17 and older, and over 8 out of 10 are young Black youth. Roughly the same demographics are seen in our detention center, which has an average daily population under 200 of its nearly 500 physical bed capacity. Our entire youth prison system in the state of Illinois has an average daily population under 300 in its facilities statewide. The demographics at that stage includes a higher percentage of white youth, but still skews older, male, and disproportionately Black and other youth of color. The youth we endeavor to support through our community corrections efforts, as opposed to incarceration, are likely to have had multiple contacts with the police, multiple referrals to the court, and multiple findings of delinquency, including some firearm involvement. Our typical terms of probation are from 18 months to 3 years. For almost 3 decades now, our department has been a part of the Annie E. Casey Foundation's Juvenile Detention Alternatives Initiative, JDAI, and our jurisdiction has remained committed to keeping detention and youth prison as a last resort. However, today, in the midst of a global pandemic and global protests against racial injustice and calls for justice reform, I believe my home court, the oldest juvenile court in the nation, is being called upon to reinvent itself. Otherwise, it is at risk of being declared obsolete at best, or at worst, being downright injurious to the well-being of children and young people, particularly Black youth, families, neighborhoods, and other communities of color. Chicagoland is reeling from gun violence and trauma, including very recent record levels of shootings and homicides, including the tragic loss of young children and infants. Amidst this turmoil, I am struck by the hope and wisdom of a young man named Charles Woodhouse Jr. in a recent op-ed he published in the Chicago Sun-Times last week. Now at age 25, he recounts exposure to deadly violence in his early childhood, losing loved ones to violence. He survived being shot multiple times at age 15 and has been justice involved throughout his youth and is currently. He asks all those who want to help him I wonder if our youth justice system is capable of doing either credibly. But I believe today's youth justice system must demonstrably and effectively do both, to feel and to heal those we truly seek to help. Thank you.
Thank you, Avik. We're going to turn now to Mark Mertens. Mark is the administrator of the Division of Youth and Family Services with Milwaukee County's Health and Human Services Department. Mark?
Good morning, and thank you, Patrick, and thank you to the Stoneleigh Foundation and the Columbia University Justice Lab for the opportunity to be here with such incredible panelists this morning. As Patrick said, I'm the administrator for the Division of Youth and Family Services for Milwaukee County's Health and Human Services Department. My division oversees all the youth justice related services for the county. A 120-bed detention center, 67 staff who provide supervision services to youth and disposition services to the court, and an array of contracted community-based services aimed at skill development, treatment, and support necessary to safely serve justice-involved youth within the community. Milwaukee, Wisconsin has the notorious reputation of being one of the worst places to live in the United States if you are Black. The 53206 zip code that spans through part of the city's north side is home to one of the highest incarceration rates for Black males in the US. Other Milwaukee zip codes are not far behind. The effects of redlining and deindustrialization have resulted in stark segregation and high concentrations of crime and poverty among North Side African American neighborhoods, where good paying manufacturing jobs and middle-class home ownership among Black residents used to be prevalent. Currently, Milwaukee County has reported over 11,000 confirmed cases of COVID-19 and 352 deaths. While people of color comprise about 35% of the county's population, they represent 80% of the confirmed COVID-19 cases in the county and 47% of the COVID deaths. In Milwaukee, as in other cities, Health and justice disparities are inextricably connected to the social determinants that are a driving force toward poor outcomes for people of color. Racism, segregation, economic disparities driven by disparate opportunities for education and employment, insufficient access to healthcare or stable housing, and disparate exposure to violence, poverty, and disease. The concepts of public safety, security, and care for all of our citizens are also inextricably connected. However, we have historically failed to realize it. We have an opportunity to correct that now. If mass incarceration was the answer to achieving a safer community, Milwaukee would be among the safest places in the US. What are the elements of youth justice that we should pursue in order to achieve safer, more secure communities? How would we replace confinement with opportunities to find purpose, hope, and connection to the community for our young people? First, we must lead with racial equity. We have declared racism as a public health crisis in Milwaukee. And as public servants, we are mandated to pursue racial equity within our own organizations, those we do business with, and the broader community. We must be at the forefront of any conscientious efforts for reform. We must find a way to change the narrative of fear that pervades our youth justice system and replace it with a culture of care and the nurturing of growth and recovery. We cannot rely on old practices that are rooted in fear. We need to eliminate the trifecta of failure that has dictated popular practices in the justice system for so long. Punishment is ineffective, unequally applied, and developmentally inappropriate for our youth. General deterrence has always been a myth, and incapacitation is a zero-sum proposition that produces no real gains in community safety. We can do this if we trust our communities and believe in second chances, both for our youth and for those with their own lived experiences within the system, who are in a unique place to give back authentically. We engage and work shoulder to shoulder with our youth and our communities if we discard our fears and start to lead with our humanity. Reason for optimism in Milwaukee as we pursue the realization of youth justice without youth prisons. I'm grateful for the opportunity to talk with you about our vision. Thank you.
Thank you, Mark. We're now going to turn to David Mohammed, who is the Executive Director of the National Center for Criminal Justice Reform. David has also served as a Chief Probation Officer, and he held leadership positions in Alameda County, that's Oakland, Washington, D.C., and New York City. He's a leader in helping cities design and implement community-based interventions, including mentoring programs and gun violence prevention strategies. David?
Thanks, Patrick. Again, thank you, Patrick, all the panelists, and Stonely for this awesome conversation, and the nearly 300 folks tuned in to us today. So again, thank you. A couple of points when I think that my colleagues on the panel have made excellent points that I want to reiterate a little bit, but I want to start on this grounding of really to repeat, I love Mark's trifecta of failure. The juvenile justice system and youth incarceration in particular, numerous studies have found that is ineffective, harmful, and extremely expensive. And it is so because of that other trifecta failure that Mark mentioned of punitive harm exacted on young people who engage in some delinquent behavior based upon the trauma and experiences of their life. So instead of engaging and healing, we have historically created more trauma. I entered the juvenile justice system having been an advocate and a direct service provider. Most of my friends thinking I was crazy to go what some folks call to the dark side. But I was clear around working with folks who are serious about making transformation in the systems. I think we made a lot of good work, but we still have a lot of good work to do. As your point, Patrick, when we have this pandemic of COVID-19, we showed what we can really do in a crisis. And I'm glad that many jurisdictions around the country did not waste a good crisis. And we did all we can to move young people out of a system to both shield them from the harm of a virus, but also shield them from the further harm of system involvement. In California, the governor has announced that we will close the entire state juvenile justice system, the Department of Juvenile Justice. And so I think that how I've couched the work of reform is in the areas of reduce, improve, and reinvest. Reduce the size of the system, improve what's left of the system, and reinvest the savings from a reduced system back into the communities, especially those communities hardest hit by crime, by violence, and incarceration. So a couple of specifics. Reduce. We in the system shouldn't be touching young people assessed as low risk or who have only been arrested for misdemeanor offenses. We really shouldn't even touch them. Shouldn't incarcerate them, shouldn't supervise them, shouldn't engage them at all. All of the research shows all we do as a system is make their outcomes worse. We should reduce our footprint and our touch to supervise young people for no longer than 1 year. Prior to COVID-19, when the state legislature in California had to significantly reduce the number of bills it took up, there was a pending legislation in California to reduce juvenile supervision on probation to 6 months. But we certainly suggest, and the research backs this up, that this should be no longer than 12 months. Improve. Focus the work of supervision and probation on positive youth development, rehabilitation, education, treatment, and support, by providing real services, supports, and opportunities to young people who are in the system, the much smaller number of young people who remain in the system. We should rewrite the position of a probation officer. The main responsibility of a probation officer should be to connect young people to service, supports, and opportunities that build on their strength and address their needs. And then POs should be held accountable and be responsible for doing just this. We should connect every young person to a credible messenger, someone who has similar lived experiences as them, who engages in a transformative mentoring approach with them, as it worked so well in New York and in Washington, D.C., and in Oakland, and many parts around the country. And then reinvest. We must reinvest the funds that has been saved from a smaller system. In the past, I think 10 years, we've had a 60% reduction in the number of youth incarcerated in America. What have we done with the savings? In parts of California, it costs $400,000 per year per youth to incarcerate. When we have this massive reduction, we should be reinvesting those funds back into the community, back into those young people, into their families and the communities they come from. And so the last thing I just want to say is we have started in my organization, the National Institute for Criminal Justice Reform, a small pilot in the city of Oakland called the NOAB, the Neighborhood Opportunity and Accountability Board. So young people arrested for felonies by the police department are not sent to the system immediately at the point of arrest. They're referred to a diversion program, this NOAB, where community leaders and pastors and business owners and formerly incarcerated young people form a council, and that young person comes before that council and they're connected to community services. It's an entire diversion out of the juvenile justice system and into the community. These are the type of programs that we need to scale to transform our system.
Great. Thank you so much, David, and all the panelists. So now we're going to get into some conversation back and forth. And I'm going to ask each of the panelists, each of whom, frankly, is quite modest. I'm going to ask you to set aside your modesty for a moment, your humility, and imagine that you're providing advice to your peers, the folks who have similar roles as you, or to other people who heavily influence the youth justice system, taking what you've learned over the course of your career and sharing it with them. I want to break it into two parts. The first is immediate. Given the urgency that the pandemic brought, where many people said, oh my goodness, we've got young people in physical situations where they're very likely to be infected, we've got to do something today to reduce the number of kids coming in and to where we can safely release young people. We've got to accelerate that. So the first set of questions I'm going to ask have to do with what you would advise your peers, other judges, other chief probation officers, other administrators, other community-based organizations, what you would advise them in how to move tomorrow to something that's different. And then after we have a round of that, I want to return to the sort of longer term question. What does the future look like? What would a really transformed youth justice system look like? And how do we get there from here? So I'm going to go again in the same order. Seems straightforward enough. So Judge Mendelson, we'll start with you. But as someone who's been a judicial leader and is still a judicial leader, but as someone who's really was more than at the table, you were leading the table when Close to Home sprang up. What would you recommend to fellow judges around the country about what they could be doing tomorrow, drawing from the lessons of the urgency that the pandemic brought to us? And what advice would you give to others who can influence a youth justice system for the immediate future, taking advantage of this moment of urgency?
So first of all, modesty aside, I never hesitate to give my opinion or advice to others, my colleagues or anyone else who's willing to listen to me. I'm not shy about giving others advice, so we don't have to worry about that. In terms of the immediate, and to my colleagues, I like to talk about the role of judge as great convener. Judges do not have to always be in charge of the interdisciplinary stakeholder meeting group, but they should be the ones that send the invitations, because when judges send an invitation, people do tend to arrive to the meeting space. I like to think in terms of shared responsibilities. When we think about the immediate and what can be done today to address issues of youth confinement, I like to think of shared responsibility, because it's not just the defense attorney who should be bringing cases to the judge's attention and saying this young person should no longer be incarcerated, or at the arraignment saying this young person should not be incarcerated. Is there something else in the community that can address the situation that's been presented? In New York City and in New York State, all over, we had prosecutors. New York City, it was the Corporation Counsel Presentment Agency that did a case review of every juvenile delinquency young person confined within the city of New York, came to a determination of a recommendation of dozens of young people that they could consent to being released at the height of when COVID was arriving in New York City at such a harsh rate, and contacted defense attorneys, came to an agreement, and brought those cases to the judge to actually make a determination as to whether young people could be released. That's something that could be done at any time, and I stress the shared responsibility. The court can advance cases and conduct regular reviews of the young people on a docket and ask the question, is confinement necessary? Because confinement doesn't work to protect our communities, we've learned over the years, and confinement doesn't work to help the young person. So confinement should be limited to only when it is necessary for young people. So the judge as great convener and all of the parties involved in a youth's confinement having a shared responsibility to review at the outset, at arraignment, and ongoing immediately after arrest, but also at every system point, whether confinement is necessary.
And Judge, I want to ask you a follow-up question from your experience, and all the other panelists, I'll be asking a similar question of you, which is, there's obviously judges are like anybody else. There's a range of opinions, a range of experiences and perspectives and philosophies. And I'm sure a number of judges had big questions and big concerns as this large change came into New York with Close to Home as an example. I wonder if you could just share what some of those concerns were and how those concerns were alleviated over time.
I will take the hit about concerns. Gladys Carrion, my beloved Gladys Carrion, who's now working, I understand, with the Columbia Justice Lab, was commissioner of our state Office of Children and Family Services, housing young people, those 4,000 young people we were sending every year to our state facility. At the time of the crisis and the time where the Department of Justice was conducting its invitation, Commissioner Carrion, then Commissioner Carrion, came to our court. I remember the day. It wasn't the office I'm in now. It was across the street, a large conference room table. I was administrative judge in charge of New York City's family courts. My supervising judges were sitting there with me, and Commissioner Carrion looked at me and said, "Stop sending children to my facilities. My facilities aren't safe." My reaction, so I'm taking the hit, was, "Fix your facility. This is your job." Her answer to me was, "No, together we have to fix our system from the very start and every point of the system, and we all are responsible for this." So one of my concerns was, there's going to be, what do we do with the children who need to be away from home? And we figured out a different way. We brought them close to home. We put in family engagement, community engagement, educational resources, community-based interventions, and safely brought those children close to home. And we reformed that system the way then Commissioner Carrion told us we could.
Terrific. Great answer. Thank you, Judge. Avik, we're going to turn to you. The same question. What advice would you have to folks essentially sitting in your chair as chief probation officers about what they can do immediately, short term, based on the lessons that we've learned over the last 3 months?
Thank you. When it was in March, early March, when in essence we were given the order to vacate the embassy, everybody needs to get out of the court building as fast as possible. And really, we didn't have a particular plan as to how that would look. But what we knew is that we had to get out of there. And what I really appreciated and hold on to is when David talked about the job description of the probation officer. I would suggest, and you see this in the background, I have compared the work of juvenile probation as being a lighthouse that lights the way back home for young people. But more specifically, it's the quality of light that we bring to the court about the whole human being that we work with, the lives that we impact, and that we need to be a lighthouse in a storm. So you get a pandemic hitting, and it's quite a storm. And what we're looking at as probation officers is all the levers that show the way back home. We needed to be able to perfect that. So we were talking about our technical violations and trying to cut them out so that we could make sure that nobody is caused to be in jeopardy of going into the enclosed environment of the facility of the detention center for any reason. We want to limit the chances that a young person will not show up because of all the chaos and get a warrant out and have to then be in contact with people, police, the justice system. We were looking at, in essence, emergency review of all our standing pre-COVID practices and saying that if this leads to incarceration, we're going to have to presume that it has to stop now. And what we want to demonstrate to our courts is that you can count on probation to be able to give you the insight, the level of awareness of the young people as they are in the community dealing with the crisis such as they're seeing it themselves. We are going to keep our staff safe that are in the detention center, that are in the court, but our focus was going to be very much about making sure we established, in essence, a default position that says no detention. But if I go a little further, what are our practices? Technical violations we wanted to be able to stop. We wanted to be able to really focus on establishing points of contact with all young people in our care. That is, in the first, let's say, 7 days of evacuation, we needed phone calls, emails, abilities to contact neighbors so that we could tell the courts that we know where our young people are and how they're doing, and they know how to reach us. You don't need to keep them in confinement. You can count on us to be able to keep an eye on them, and we'll deal moving forward.
So I think there's a way in which you sort of started to answer my follow-up question, similar to what I asked Judge Mendelson. So over the course of JDAI, you've seen, I'm sure, a lot of concerns raised by different important stakeholders, your own probation staff, judges, prosecutors, et cetera. And during this accelerated focus, I'm sure you've had some concerns raised. Could you just take a minute or two and talk about what those concerns are and how you and others have tried to respond to them.
Well, two extreme points in context, in full disclosure to the audience, one is, as a JDAI site, no one was going to introduce the concept of detention alternatives to our county. I mean, that's what we do. And what happened was, the moment that there were calls to decarcerate, well, it was a hard narrative to figure out the young people that are sitting within the four walls of the detention center. If we could have had them on one of our alternatives, namely electronic monitoring, the shelter or evening reporting center, or curfew, we would have. Arguably, the judges had a narrative as to why they were in the detention center. That was also butted up against regular demonstrations around our detention facility calling on the court to decarcerate, and charges, for example, plastered on our wall of the juvenile court, guilty of genocide. That was happening at the time that we were being called to decarcerate. Now, in that frank moment, we are looking very much to say, okay, the young people that are in detention, what are the narratives that are currently keeping them there? And what additional narratives, what additional insight can we bring to be able to have these matters reviewed? And we're very grateful that judges were conveners, that our defense attorneys and state attorneys were all Zooming in regularly to pull together opportunities for review of detention. And we wanted to be probation, the eyes and ears that presented, this is what we can do while they're in the community. And I think that led to a concerted infrastructure that I think we should hold on to moving forward, of how we think about why a young person meets a particular bar to remain in custody versus out in the community.
Great. Thank you, Avik. Appreciate that answer as well. Mark, we're going to turn to you now, and the same question. What would you advise your colleagues who are administrators in youth correction systems? And just to anticipate the follow-up before I follow up with it, what is some of the pushback that you've had? Now, before the pandemic ever started, you're on a path towards major reductions in the numbers of young people going to the state and in detention in Milwaukee. And just talk a little bit about some of the things that you would recommend to others that they could start doing tomorrow, and then the question of how you respond to the concerns that many of your stakeholders might raise.
Yes, well, hard to know where to start, Patrick. So many great insights already from the panel. Absolutely important to be courageous, and examples like Gladys Carrion and others on this panel around the courage to stand up and be the one communicating about doing the right thing. It's sometimes a lonely place to be, but is really absolutely essential. And eventually people come around. We're fortunate right now in Milwaukee to have things really aligned quite well in regard to leadership from our new county executive. We just elected our first African-American county executive in from our county board, all the way down through leadership within our department and of course our division around racial equity. We've, as I've said, we've identified racism as a public health crisis in Milwaukee. We are actively working to address that. I think the first thing I would offer as advice would be to lead with equity, to be aware that this pandemic has highlighted every type of disparity that exists for Black and brown people in our country. It's highlighted and exacerbated every single one of them. In particular, I can think of in Milwaukee a political example. When in April, in the middle of the pandemic, we had held a primary where the voting places in Milwaukee were reduced down to five for the entire city of Milwaukee, 600,000 people, five voting sites, and people stood in line to vote in the middle of the pandemic. It was inspiring to see, but in the suburbs that are mostly white, each of the suburbs probably had 5 voting places. It was not a problem for people show up and vote. So the obstacles there were incredible. Of course, it relates to health. I gave you the statistics about the impact of COVID on our Black and brown population in Milwaukee. Must lead with equity. We must have a system that is as effective for every youth and every family as it would be if it were my youth, my child, and my family. I think someone said once, maybe it was Vinnie Schiraldi, said that an effective juvenile justice system already exists. It's the one that white youth and families receive in this country. That's essentially what we need to do, is first pursue equity, but also to be diligent in doing that, and not just when we faced a crisis. When I started in Milwaukee County in March of 2016, we had an average daily population of over 130 youth in our 120-bed detention center. So we had youth sleeping on the floor. We were in, every day we were in violation of code because of that. It was a dangerous situation, frankly. I can't imagine if the pandemic had hit us at that time, what a crisis it would have been for us. But because of the work of my team, my superintendent, detention superintendent, and others on my team, as well as our presiding judge and other leaders within our stakeholder group, we've managed to get that number down significantly. I think today our count is 57. And so it's very manageable. We're able to isolate new youth when they come in. We've had no cases of COVID in our detention center to date, not among our staff and not among any of the youth. And it's largely because we've been able to manage the numbers over time and accomplish the types of reductions. The other thing I would say is that what we do after the crisis is going to be important. The new normal needs to look different than the old normal. The things that we put in place to continue to further reduce our populations, like in our case, the executive order from our presiding judge that no misdemeanor warrants are to be brought to detention, is something that needs to persist beyond the resolution of the pandemic, whenever that time comes. We need to sustain policies like that have not compromised community safety, but have made it better for our youth and our families.
Thanks, Mark. David, you've worn so many hats from so many different perspectives in your career in youth justice. So I'm particularly interested in your thoughts on what you would advise your peers who are advocates, your peers who are working with community-based organizations, or if you have some thoughts about probation officers and judges and others as well, please weigh in.
All the above, but judging. I haven't done that yet. So, a couple of thoughts. One, I think I really appreciate everybody, the panel, who's been incredibly thoughtful. But we've seen pretty extraordinary changes during COVID. We should codify these changes, right? So we don't just resort right back to the same things we were doing. I think in New York City, where Judge Mendelson is, there even before COVID, right? So you have a city of 8.5 million people where there were only 120 young people under the age of 18. That's not even all in the juvenile justice system, but comparable to most places, 120 young people under the age of 18 in detention. I think less than 20 post-adjudication in the juvenile court who were in a secure facility. And because of close to home, that secure facility is a home that is secure. And so pretty extraordinary numbers. In San Francisco, where I'm working with the mayor's office and the board of supervisors to close the detention center, the board of supervisors there, with the county commissioners, decided to close entirely their one juvenile detention center by the end of 2021. We averaged about 30 young people in that facility that has 140 beds. And during COVID, we've been down to as low as 7. I think we're kind of averaging 9. And a city of 900 plus people. So it shows what you can do, right, when you get a little bit more serious, a bit more focused. So we should codify those practices. The other thing I would say for all of us in working within the system, working with the system community organizations. And I remember being at a JDI conference and speaking about positive development and the difference between probation practices from one county to the next, right? So the great work that Avik and his colleagues are doing. I know that unfortunately it's not exactly the same in DuPage or Kane nearby. You know, I'm sure they're doing some work, but it doesn't look like what Cook County is doing. And I remember making statements like this at a panel at JDI, and I think it was the Lucas County Chief Probation Officer who said, there's one thing about county to county, what about cubicle to cubicle? Right, the different type of work in the same office from cubicle to cubicle, and hence the reason why there's some really great POs who do good work. And when I talk about, you know, making sure your number one responsibility is connecting young people to service, supports, and opportunities, I often get in an audience POs to say, that's what I do every day. I was like, great, keep doing that. But it's a problem that the PO on the cubicle next to you doesn't. And that's why we need to literally change job descriptions, change performance evaluations, and hold folks accountable and make their responsibility, and train them and support them and coach them and encourage them to do the really, really good work of connecting young people to service, supports, and opportunities. The last thing I'll just say, in the community, we have to do the same thing. You know, sometimes we have this false narrative of POs are terrible and community-based case managers are great. And that's not always true. In fact, there was a jurisdiction I conducted a training for virtually recently where the community-based service providers, when I gave them a scenario, came up with much more punitive outcomes than the POs do when I give some POs the same scenario and basically the same training. So we have to, everybody should be trained and understand positive development, building on strengths and assets, not focusing on deficits. Young people don't come to us as bundles of deficits. The last thing I'll say on this is really distinguishing between young people of low risk and moderate risk and high risk. And I'm not talking about just the use of risk assessments, but understanding these young people, that there's a small number of young people who are at a very high risk point. That's the population that we really, as a justice system, need intervention with, right? And Avik's in a city that's really challenged with gun violence. The other side of the life I live is around gun violence reduction work. And too often they're separated. I do the juvenile justice work over here and the gun violence work over here. Needs to be connected a bit more. But there's a small number of people who are identifiable, right, and that we can intervene with. And that's that small population that we need to use our limited resources as a system to have still positive intervention with. And we really need to have our level of focus, particularly, again, given small resources. But even in the community, we need to understand what we do with at-risk 14-year-old who has been skipping a little school, and what we do with a 21-year-old who is, you know, running with a crew or group or gang, who's carrying a gun and posting violent messages on social media. That looks different. Our intervention with those two young people need to look a lot different, and how we engage them need to look different. There's not a one-size-fits-all for the system, nor for community services.
David, that feels like a natural transition to our next topic, but I just see, Avik, did you want to add something?
Yeah, I'll keep it brief, but I wanted to, David, it's wonderful that you're getting a positive vibe from Cook County. No one here is claiming perfection, specifically in the idea of cubicle to cubicle. The idea that says that when we think about the job description and a focus on being able to connect, be a great connector, I just want to acknowledge, and I know it's implied in what you're saying, but this is where the heavy lift of a transformed youth justice system, I believe, in terms of probation, it's about deciding what kind of relationship do we want with the young people whose lives we are trying to commit to support, to change. That implied, if we're going to be an effective connector, is that it matters that we have a relationship that supports this kind of change. And the skills around building that relationship can vary from cubicle to cubicle. And we're going to have to stake some claims as to how that relationship is grounded in the ability to see the humanity across the relationship. And that involves a level of skill building that I think is part of the profession. When we rewrite the job description, we're really talking about the kind of relationship we're expecting as a professional probation officer to be able to support a young person and get out of sort of their way and recognize the world as they see it, and then build our plans for change and success around that. Thank you.
Great. So there are a number of folks who have questions that we want to get to. So I'm going to ask this next round if everybody could be both ambitious and succinct, so we save some time for folks in the audience to have their questions addressed. And David and Avik kind of in some ways started to introduce this question, which is, you know, there is long overdue demands for rethinking everything about our law enforcement and criminal justice and youth justice systems. And I think there will be a lot of room for not only conversation, but change over the immediate term, leading to hopefully long-term fundamental and transformative change. So I'd like each of the panelists to take a moment to dream and to think about what does that transformed youth justice system look like, just focusing on the youth justice piece of this. What do we currently rely on that we would not be relying on either at all or not as much? What would be there instead? And again, David and Avik began to kind of raise this. And how do we get there from here? So again, Judge, I'm going to start with you, and we'll go through the same cycle.
So I'm going to be really brief so we could hear from the people who are doing this work on the ground. By the time you get to the judge, too much has happened that could have been prevented, and I want this reimagined system to not include me. Keep our judges for our civil courts, and reduce the need for having so many of us in our youth and criminal courts. I should be out of business. Our criminal court judges, I don't want to put them out of business. I just want to put them in other areas where we could use them more. And one way is, the thing that I would most keep if I ruled the world was our ability to reduce arrests at the height of this pandemic. If we were only arresting young people for the most serious offenses, alleged offenses, we should not go back when there is an end, if there is an end, when there is an end to increasing arrests for less serious offenses. Whatever was being done during COVID crisis as an intervention to prevent bringing those cases before judges, that needs to continue when we are done and not go back.
Great. Thank you, Judge. Avik, I want to pick up again on some of the points you already raised, but thinking about the system as a whole.
I guess I'm looking for a reboot as to what is the priority of the youth justice system. I think 120 years ago, it was looking at a world through a lens that centered the white experience, white families, the well-being of white children. And I think what we're looking for now is a more human youth justice system that could center around the communities that are most impacted. And I specifically am thinking, specifically in the city of Chicago, the lives of Black children, lives of communities of color, historically disinvested, whose routinely they access the juvenile justice system because of the one thing that we can do, which is we could lock people up. And the idea might be that we're going to have to step back from that and reimagine that we might not need to lock people up in order to help them succeed if we can work on the other things that are bringing them to our court in the first place.
Great, thanks, Avik. Mark.
I hesitate a little bit even when I hear the term justice system, because system implies to me that it's just this sort of, what it's become is this sort of labyrinth that sucks in our kids and adults too, for that matter, in the adult system, and hangs on to them until we sort of spit them out broken at some point in the future. And I think that we have to get away from that. I think it has to be much smaller, as David mentioned before. It has to be much more focused on solutions, on skill development, on adolescent development. I'm fascinated by some of the jurisdictions that were mentioned. Certainly want to come. Avik and I were talking about a visit once things get back to normal, since we're only an hour away from each other. and share some ideas, but I'm fascinated by places like Pierce County, Washington, that's looking at and implementing a more incentive-based and more developmentally appropriate justice system. It doesn't involve months and months and months of supervision, waiting for youth to not comply so we can bring them back, but one that really helps to propel youth towards success. I think that's what we need to become, and I think that's attainable. Although I think we're a ways from it right now. We have some work to do.
Great. Thank you, Mark. David, you're going to get the last word on this big question, which you actually started to address, and then we're going to turn to the questions from our audience, or quite a few. So we've got a good half hour ahead of us to hopefully get to most of the questions. But David, please.
Yeah, so briefly, first I would say we need, time out of the community should be reserved for the very small number of young people who are a genuine risk to the public safety. And then that time out of the community must look much different, deliberately calling that instead of incarceration, because we really have to reimagine what that looks like. There is a small number of young people who are a genuine risk to public safety, who we need to have some good rehabilitative, positive development, treatment-oriented time out of the community. But the reality is that's a small number of young people versus the current number that we have in the system. Then we need to develop a community-based system of services, supports, and opportunities where young folks get the type of engagement. And, I've had schizophrenia in my career. Obviously, I've been in the system. I was a system advocate inside, outside. But when I was in the system, I wanted to hire POs, as Avik mentioned, like to have relationship-based, to be these kind of transformative mentoring leaders, versus wanting to turn them really more into quality assurance of a community-based system. Right? Because we're going to be in their lives as a system for a small amount of time, hopefully, but they're going to always be in the community. So we should really strengthen their connection in the community with folks in the community who can be a lifelong bond to them. And so really developing a system where they can be connected to somebody who is going to help them navigate through education and every other systems and employment and higher education, someone who's going to have a genuine, positive, trusting relationship with them. And I often say is what young people need the most is a healthy relationship with a positive adult. The system should be helping to make that happen. In a much more systematic way, to Mark's point, right? Not happenstance, not come into this justice sector where there's various players and chew you up, but ensuring that every young person that we come in contact with has a healthy relationship with a positive adult, and that we're only connecting inside the system, inside of incarceration, that small number of young people who are a genuine risk to public safety. And then we can have real reinvestment into the communities that our young people come from.
Well, thank you all. I'm going to ask Mark Hauck to come in and to share some of the questions that have been rolling in over the last hour.
Yes, thank you. We have many questions, so I apologize in advance if any of these have been answered already, but we'll try to get through as many as possible. The first comes from Gabe Stern, who is a reporter with the Juvenile Justice Information Exchange. Gabe says, "Hi all, thanks for being here. I'm wondering how the Raise the Age Act and the expansion of many youth detention facilities because of this affects any immediate and long-term reforms that the pandemic and protests may bring to light. With some youth detention facilities already expanding because of the act, how does this affect reforms in those areas?"
I'm going to suggest, since New York just went through a Raise the Age Act, that maybe we start with you, Judge, and then if others want to weigh in. David, perhaps you can get ready to respond to that as well. I suspect the question comes in regard to a specific jurisdiction that recently raised the age, and I'm going to assume it's raised the age to 18 as opposed to Vermont where they raised the age to 20. But since we're talking about most systems rather than just a couple right now, let's, if I can, just make the assumption that it's one of the states that recently raised the age up to 18. So, Judge, your experience in New York, what you've seen in Raise the Age?
So Raise the Age in New York is recent, and as I mentioned, we now have, as of October of 2019, all cases of children who are arrested who are 16 and 17 years old, if they're misdemeanors, they're in the juvenile system automatically with diversion opportunities prior to case filing and bringing the matter to court. And for those felonies, they start in the adult system and have a mechanism, and that mechanism continued throughout COVID. Our departments of probation throughout the state have been actively working to divert cases that came from the adult system as felonies and removed by transfer to the juvenile justice system with diversion to prevent a case filing, and that continued. What we have experienced in New York, which has happened in many other states as well, the fears that we had of our increasing incarceration and confinement for young people once we've raised the age did not happen. Even though we are bringing many, many more young people into our juvenile justice system after raising the age, the use of facilities and institutions and incarceration and confinement remains at an all-time low. And this was before COVID as well. We were reducing our adult justice system touch without increasing the use of detention and placement and places of incarceration. So even though you have to prepare your system with alternatives to incarceration programming, which is really, really important, as well as having sufficient places to house and detain young people, the children and young people that we have to end up using incarceration for is a relatively small amount.
And David?
I think Judge Middleton answered it perfectly. I was going to mention that the New York case is to be studied. There was a lot of fear that there would be this increase. The opposite happened, right? Like there's a net decrease, even with 16, 17-year-olds in the system. The one thing I'll say is, California proposed raising the age to 20 kind of across the board. It was taken, the measure was taken off just because of COVID. They had to reduce the number of bills that the legislature was going to address. And I think there's a lot of conflicting or competing goals that we just have to be aware of. Some of this stuff is a little more nuanced than straight up, but generally raising the age has been a really good thing. If Jane Addams and others were back in Chicago thinking about the creation of the juvenile court today, they probably wouldn't pick 18 as the stopping point. It was just, they just picked an age. They would probably pick another age now, especially given what we know about brain development and the like. And so I think it's natural, like many European countries, to go up to 21 years old in the juvenile justice system.
So just two quick observations. I'll take my moderator hat off for a minute. One is, over the course of more years than I care to admit, of listening to people project what the impact will be on a system of a legislative change or a systemic change in terms of demand for different services. I have literally never seen any of those projections be accurate. Whether you're starting with the projections of the super predator era, and we better build a bunch of beds, and at the very minute that started, youth crime started to go down, and people said, well, that's a temporary blip, and it continued to go down for 25 years. In the exact opposite direction that all of the experts projected. To raise the age, and that's my second observation, as David said, there are European countries where the age is not only 21, there's some places where it's 24, 25. And what they found when they made that change is they planned for needing a lot more beds and, young people with much more serious charges. What they found is that the younger people who had been seen as sort of grist for the mill of the system, the 14, 15, 16-year-olds, all of a sudden they started treating those 14, 15, 16-year-olds like the 14, 15, 16-year-olds they are, or as Vinny said, like the white kids would be treated at 14, 15, and 16. And the population, certainly the numbers of cases expanded, but the number of beds did not have to expand in anywhere near the numbers that people had projected. So again, I'll put my moderator hat back on and turn back to Mark and ask for the next question.
Next question comes from Shay Bilchik, who says, I was intrigued by David's 3 pillars: reduce, improve, and reinvest. This paradigm is very similar to the framework undergirding Reclaim Ohio and to some degree, Redeploy Illinois. What are the lessons learned from those efforts that can be incorporated into our work moving forward more broadly?
I'll answer quickly, and then Avik around Redeploy Illinois. So I think you have a bunch of successful examples across the country of different jurisdictions. Certainly Reclaim Ohio, and there's been there's been a couple of efforts to try to go further. And so I think what the premise of this panel in terms of COVID has showed us, we actually can go a lot further than we have done already. So I would just say in both of those examples of Reclaim Ohio, Redeploy Illinois, is they were great starts, and we can go a lot further. And with understanding young people, I think it's also a question we hopefully can get to about restorative justice. There are other practices that are incredibly effective that don't have the harm and expense of formal involvement in the justice system, that we should explore with a lot greater number of young people. And so I would say those are good starting points that we really can expand.
Avik, do you have thoughts on Redeploy Illinois?
Well, broadly, I'm affirming that is in fact the value set that's there, with the idea being that moving away from incarceration and investing in the community that would otherwise be represented inside the four walls of our institutions. That's there. I'm just acknowledging that perhaps I'm getting a sense in our jurisdiction, and I feel like David was touching upon it as well, is that we're in a moment where we're also kind of trying to let's say, develop and refine the community-based technology that's the alternative to us. And there's this massive philanthropic sort of push that we're seeing. I'm seeing that there is a level of, I don't know, some Darwinian stuff playing out between nonprofits trying to work through where they are going to slot in to support young people at risk of being justice involved. And this mere mortal, humble administrator is trying to figure out where is it that we reach out to in the communities to be able to connect. So we're seeing something like investment and a lot of money coming in to communities, particularly on the south and west sides of the city of Chicago. And yet we are finding that has in and of itself a sort of industrial complex feel that we're trying to navigate. And so I'm just acknowledging that the pillars are there, the good intentions are there, but I find that there's still a little bit of a Wild West feel for how things are playing out at the community level in terms of what are the approaches going to be taken with the reinvested dollars, let's say.
Great. Let's take the next question, Mark.
Okay. This one comes from Aaron McMillan. Hi from Washington, D.C. I'm an intern for NCSL and wondering if any of the panelists have tried or looked into restorative justice practices and seen success or failure.
So David, I think this is right up your alley. I'm going to start with you, but then ask any of the other three panelists to weigh in as well.
Yeah, I was going to say I could be quick. So yes, but I think there is some great examples of very effective restorative justice programs. So the organization I used to work with, Impact Justice, has a very successful restorative justice practice. The head of that recently won one of these MacArthur Genius Awards. And they have programs around the country, but particularly in different California cities. Then I'll just, the program I mentioned before, the Neighborhood Opportunity and Accountability Board, NOAB. I'll try to do this quick, or maybe I'll respond to the chat. But my website, nicjr.org. If you do /NOAB, NOAB, you'll get a description of that. But we specifically have a restorative justice component with a partner organization, Our Joy, Restorative Justice for Oakland Youth. There's some really effective restorative justice programs. The only thing I say is, restorative justice is a part of a continuum of great programs that can be effective, right? There's some restorative justice adherents that think it's the only thing that you can do, and I love their passion around it. But restorative justice is a component of a very great continuum of alternatives to formal system involvement.
Any of the other panelists want to add anything on restorative justice?
I would just say, Patrick, that it's a part of a lot of our community-based programming that we do in Milwaukee. Organizations like Running Rebels, which is a mentoring program, credible messenger type of program that works with many of our youth. There's a restorative justice element in that program, and pervades through a lot of our different programs. But I do think, and I'll admit that I think we should be more intentional in Milwaukee about ensuring that we expand restorative justice as we expand our work into the community, and become more a part of the community rather than just sort of using the community as advisors for us in a sense. I think we will be incorporating much more around restorative justice practices.
Thank you. Mark, next question?
Yes, so next question comes from Phil Harris with the Department of Criminal Justice at Temple University. Has the current pandemic affected the availability of resources for youth in the community? For example, mental health, boys and girls clubs.
Mark, maybe a good question for you to tackle. Mark Mertens, is that, have you seen this?
I would say yes, absolutely. We're doing a lot with telework, and I think everyone is doing a remarkable job in engaging youth as best as possible through telework. Programs are starting to open up carefully a little bit now, but it's certainly had an impact, and we try to mitigate the impact as much as possible with telework. I think we made up for the loss of, well, not completely made up, but we tried to make up for the loss of individual contact with frequency of contact. So we had a lot more contacts by telework with youth and families. You can't really replace being face-to-face in a room with someone.
Right. And I think one of the other panelists started to respond as well.
I was going to say the same thing. Yes, I think the unfortunate thing is yes. To be honest, I've seen some really innovative virtual replacements that have been great, but you ultimately can't replace the face-to-face. The one thing I'll say is there's several cities, Chicago being one of them, who formally said street outreach and intervention workers are essential workers, and that they continued with appropriate PPE to continue to do in-person work. And there's cities that have done extraordinary. Newark, Stockton, California, that have done pretty extraordinary work with outreach workers being essential workers.
May I just say one thing, please? The community-based organizations that did operate in crisis mode shifted their operations. Not only did they start giving services and providing those services virtually, but they also made their service provision different. They had to buy computers, laptops, and tablets and deliver them to our children and their families. And sometimes they had to buy groceries for people in need. And the focus on the idea that, oh, this is just going to be over, the lingering economic crisis that I'm told is coming and is going to have such an impact. We have to think in terms of our service provision of basics and essentials of life, along with providing telehealth and counseling and services.
Mark, next question.
Next question comes from Joyce Burrell. Can you provide advice, including enabling legislation or tools to jurisdictions that believe they cannot use technology to improve conditions to families and community agencies of youth who are still in secure settings today?
And is that, I wonder if that means young people who are waiting for court action and the courts have said they don't want to use video conferencing? Is that a thing? Is that a concern? I'm just trying to understand which technology and what the barrier is. You know, maybe Joyce, if you're still here, if you could sort of add to your question, and we'll circle back to you in just a minute. Unless one of the panelists, yeah, let's circle back to Joyce and go to the next question. And Joyce, if you just kind of clarify a bit which technologies and which barriers you're thinking about.
Okay, so next question comes from Melissa Sickman We know that youth in the justice system come with a lot of traumatic stress, and working in the system is also related to traumatic stress. Have you seen any changes since COVID in the levels of trauma among youth, their families, or staff, and how has it been addressed?
You know, I would say I've personally seen more impact in regard to the recent public discourse around race and the trauma that's had on many of my staff that are sort of reliving some trauma, some past experiences with racism, and there are lots of challenges, a lot to be thoughtful about around supporting them in the work, and making space just in division meetings for people to talk about their experiences. We have our meetings are much less full of content of late and much more about processing and supporting each other. And I think that's been a big trend for us. There's been some around COVID too. We've had some family members of youth that have had COVID. We had some trauma. We had to retrieve a youth from an out-of-state placement where the whole place was full of staff and other youth that were infected. That was certainly traumatic for everybody involved. So yes, there has been an increase.
Other panelists?
No, I'm just going to echo and say ditto to what Mark just described, that's something that is very much in our space. And it's something that I think the word was to codify into the future. This gave us exactly the kind of moment to be human and empathize with each other, staff and our clients and families, etc., to be able to say we're all going through something. And in order for us to be our best selves, we're going to have to create space just to process. That's going to be part of our work together, those human interactions. And so I just wanted to just underscore that it's part of the work that we have to do in administrating to give space for our staff to be able to express themselves, to be able to connect with each other, and understand that this is, if I can process that, I can also be much more present and available for my young people and families that are going through this as well.
Terrific. Mark, next question.
Yes, I believe we have a follow-up from Joyce, who said both those waiting for court action and those who are held securely as part of their ongoing disposition. Some agencies decided they are not allowed to use Zoom, webinars, FaceTime, Skype, Duo, and others during this time that visitation has been eliminated.
Okay. Well, Judge, I'm going to ask you perhaps to weigh in if this were going on in your jurisdiction, what your response would be.
I would say that I would remember that this new system that we created was created out of crisis. So it wasn't an opportunity to plan. I would say that for visitation, for instance, if we have stopped family members from coming into facilities for safety, we must replace that with the technology that permits some level of contact, which is not the same as face-to-face, but it's contact by way of Zoom or Skype or FaceTime or the telephone. Facilities have telephones, so they have to increase contact. It took a while for us to make sure to retrofit technology that was meant to have conferences to utilize those for court appearances. But even, Rikers Island and Crossroads and Horizon in New York all have special rooms and setups for youth, separate and segregated from the adults, to have their own private time in court spaces. So the possibilities are there for court appearances as well as for the contact. And I just think that it's a no-brainer that in the crisis moment, perhaps it wasn't immediately done, but there's no excuse to not do it. It's important.
I find myself thinking about the numbers of times when I was in some position of responsibility or authority and somebody would come to me with some idea of something they wanted to do, and my first reaction was, no, we can't do that. And where I was lucky enough to have a staff person or someone from outside the organization to call me on this and to essentially say, no, wait, what's your value, right? Where's your values? And I'd be, oh yeah, let me just put my bureaucratic mindset to the side here. Let's get a little bit creative. And what my initial reaction was one of, no, we can't do that, turned into, oh my God, why didn't we do this years ago? Because it works better. And it's important and it's aligned with the values that we hold. So I think sometimes it just takes a little more push, a little more shaking, and perhaps sharing of examples from other places around the country where there are lots of places that are using technology now and successfully. So you're no longer on the bleeding edge if you're willing to experiment with some of this. We have just a minute or two left. Mark, other questions yet to be raised?
We do. So we can take another question. This one is from P.O. Yolanda Miles. What are your thoughts on a more personal approach to probation as a useful tool as it relates to positive behavioral and emotional change in juveniles in the justice system? Could this be the pipeline moving juveniles from delinquency to higher learning?
So I'm going to start with Avik and maybe ask David, who's had a similar role, to respond as well.
Well, I'm acknowledging if this is P.O. Yolanda Miles of Chicago, P.O. Yolanda Miles, I've been saying hello, and she could present on this as an example. That's where her heart is, and that's the kind of thing from cubicle to cubicle we want to replicate. I'm just acknowledging, but giving deference. Yolanda, be treated to other folks here. I'm just pointing out that would be, let's say, our commitment is what role would a probation officer play to helping young people achieve the kind of outcomes we would want for all young people? It's not merely the mercy we show in keeping them out of prison. It's really about the level of kind of leaning in that we do to help them achieve greater things and disrupt ultimately this pipeline that puts them into prison. So those techniques I'm very much interested in, and I would defer to my other panelists to share further insights.
Yeah. So Dave, did Yolanda work for you at one point? Or
no, but it sounds like I wish she did. So a couple things, and I mentioned earlier, I have schizophrenia on this. So I'll try to be both quick, but talk about how I struggle on both sides of this. That is, I think the obvious question is, yes, we need good, passionate, caring POs. I know of many, many, many good, passionate caring POs who came into this work to make a difference, who are making a difference. And sometimes that's despite of their system. Sometimes that is going around their system. And sometimes that's despite colleagues that they have who aren't similar. Whereas there's other places, and it sounds like Cook County, where that is encouraged and developed, and that's certainly what we try to do in DC and in New York City and in Alameda County and Oakland, where I've had the opportunity to serve in leadership in these agencies. But so what I'll say is, we have the challenge of, if we're doing the right thing, the POs should be in their life for a small period of time formally, right? I know POs who continue to work with young people way beyond, they're out of the system and off the caseload. That is extreme commitment, and we appreciate that. But if formally you're only supposed to be in their life for 12 months, then we really should prioritize their a long-term relationship in the community. But that doesn't mean you shouldn't also be caring and compassionate and be able to be a transformative figure in that young person's life. Again, often, I'll just say this, often when you ask young people what they want to be, especially in detention centers, they talk about being a detention officer, right? Because that's what they've seen, that's what they know, and there have been some people who care about them, even in a pretty rough setting. And often you'll ask young people and they'll say POs, because that's the profession that they've seen. And so, yes, and I would say it's yes, and we have to connect them to somebody like that who's going to continue to work with them in the community.
David, thanks so much. And let me thank all the panelists. My biggest hope was that this would be a conversation that would spark other conversations among all of those who were listening today and contributing some of the questions. You each are among my pantheon of heroes, of people who are really leading a change hand in hand with lots of other folks. This is a unique time, obviously, for our country. It's a unique opportunity. And I know that you all are working awfully hard to make sure we don't miss it. So thank you all. Thank you to everyone in the audience. And please stay safe to the extent you can, stay sane, and keep working toward the vision that you have for how we ought to do better by kids and their families. Thanks so much.